Let's delve deeper into the importance of digital nursing. Beyond the benefits. While the core benefits you mentioned hold true, digital nursing offers additional advantages worth exploring. Empowering patients, technology can put patients in control of their health data, allowing them to track progress, manage medications, and participate actively in their care decisions. This fosters a sense of ownership and accountability, potentially leading to better health outcomes. Personalized medicine digital tools can analyze vast amounts of patient data to identify patterns and risks, enabling tailoring of care to individual needs and preferences. This personalized approach can lead to more effective interventions and preventive measures. Education and communication digital platforms can be powerful tools for educating patients and fostering open communication between nurses and patients. Educational resources, virtual consultations, and secure messaging platforms can bridge the gap and empower patients to make informed decisions. Research and innovation digital data collected through wearables, apps, and HRS can fuel research on disease prevention, treatment effectiveness, and personalized medicine. This data-driven approach can accelerate innovation and lead to advancements in healthcare delivery. Addressing workforce challenges, digital tools can assist nurses in managing documentation, automating tasks, and accessing vital information quickly. This can alleviate their workload, reduce burnout, and potentially attract and retain talent in a strained healthcare environment. Challenges and considerations. While digital nursing presents numerous advantages, it's important to acknowledge its challenges. Digital divide, unequal access to technology, and digital literacy can exacerbate existing disparities in healthcare. Strategies are needed to ensure equitable access and bridge the digital divide. Data privacy and security. Protecting patient data is paramount. Robust security measures and ethical guidelines are crucial to ensure patient privacy and trust in digital solutions. Technological limitations. Not all technologies are equally mature or effective. Careful evaluation and integration are essential to avoid reliance on untested or unreliable solutions. Workflow integration. Seamless integration of digital tools into existing workflows is crucial. Inadequate integration can create additional burden and disrupt established care processes. Human touch. Technology should never replace the human connection in healthcare. Digital tools should complement, not substitute, the personalized care and empathy that nurses provide. The future of digital nursing. Digital nursing is evolving rapidly, with new technologies and applications emerging continuously. It's crucial to embrace this evolution while navigating the challenges responsibly. By fostering collaboration between nurses, technologists, policymakers, and patients, we can harness the power of digital tools to create a future of healthcare that is personalized, efficient, accessible, and equitable for all.